All right. Well, good evening, everyone. Thanks for having me this evening. I won't take up a lot of your time. It's a beautiful South Dakota evening out there, but happy to answer any questions that you might have. My name is Mike Elliott. I'm trained as a pediatrician. For the last decade or so, I've been the chief medical officer at Avera McKinnon Hospital in Sioux Falls. I'm supposed to remind folks in video land that please submit your questions via the chat, and we will try to get to those. I've got just a couple of opening comments. This won't come as any surprise to you. I think vaccines are helpful. I think they're safe and they're effective. I think there's a lot of mitigation strategies out there. I'm thankful that we're not helpless in this. We're not stuck just sitting there and hoping something bad doesn't happen. There's a lot of things we can do to protect ourselves individually and protect our schools, our kids, our communities. I am not an educator. I can't tell you what to do in your schools. I'm going to leave that up to the school principals and superintendents and the teachers. They know how to educate our kids more than I ever will. So I'm going to leave it in their very capable hands. But I am happy to answer any questions that you might have, things that you've heard, things that seem a little confusing when you're on social media or watching the evening news or reading in the newspaper. So with that, I'm happy to begin to answer questions. As things come through the chat, will you let me know? None yet?
Dr. Elliott, one of the questions that I think that we've been hearing is just as far as the boosters go for staff and that would have chose to be immunized last spring. I'm assuming they go to their general practitioner, but what's kind of that general rule for those asking, should I be thinking about the booster or?
Okay. That's a great question, and maybe I can help clear up a little bit of the confusion. For a subset of the population, those that have been classified as immunocompromised, so they're receiving active cancer therapy, or they're on some sort of an immunosuppressant medication, or they have a congenital immune problem, have HIV. They're in a group of folks that actually it is recommended that they get a third dose in their series. They're not calling it a booster dose. It's the third dose in the series. So that's one piece. Now, the other piece for folks that have a good immune system, there is conversation about giving a booster dose. And I think that's what we're hearing a lot about on the news right now. From what we've seen from the research, our immune system, and this shouldn't be a surprise, it wanes over time. You get any illness, and you're pretty immune right afterwards, but over time it wanes. So natural immunity lessens over time. So does immunity that comes from a vaccine. We know this, we get a flu vaccine every year. You need a tetanus booster every 10 years. So we have multiple examples of this, and we're just take it for granted, it's the way that it is. The COVID vaccines are going to work the same way. It appears that over time our immune system may weaken a little bit, and we may need some series of booster doses. I can't tell you how often yet. I can't tell you an absolute number. I can tell you that, you know, there are parts of the world where the vaccines are incredibly scarce. Countries in Africa where the rate of vaccination is between 1% and 2%. And so there's a conversation about, Should a country like the United States that has vaccines in excess be giving a booster dose to our country, or should we be shipping that vaccine to other parts of the world who are in desperate need of it? I guess the best answer I heard on that is that we have enough we can do both. We can ship hundreds of millions of doses of this vaccine to other parts of the world where they're in desperate need of it, but we can also give a booster dose to the U.S. citizens, folks here in our country that are going to need it. I know President Biden and others have come out saying it's going to take effect maybe as early as September 20th. I think he's right. Reading the research, looking at what he's looking at, I think he's right. But it's important for us all to know that the FDA hasn't actually fully approved the booster dose yet. So we do need to wait for full FDA approval on the booster dose. And then we will begin to figure out, how do we disperse it? Do you need to go to your primary care clinic to get this? Are there going to be large community vaccine clinics set up for this? Maybe you can go to your local pharmacy, grocery store pharmacy, and they can give you the booster dose too. So I don't have all the answers on that yet, but that's what we're thinking about.
A question that we
yeah.
get a lot is, my child or myself, I've had COVID recently, so why do I need to get the immunization?
Yeah.
Dr. Elliott, will you do me one favor and repeat the question for the viewers?
Happy to. So, great question. If I've had COVID already, or if my child's had COVID already, why would I consider getting the vaccine? Was that a fair summary? Maybe anecdotally, if you've ever had strep throat, are you convinced you're never going to get it again because you had it once? Or if you've had a cold, does that mean you're convinced you're never going to get one again because you had it once? A little bit of that same logic applies with COVID. Remember, COVID's the illness. The virus is SARS-CoV-2. Semantics, maybe. But as the virus mutates, maybe I've got really good immunity to a couple of the viral variants, but maybe not to the next one that comes. And there are more that are emerging and are being closely watched to see what they do if they last. So because of the virus's ability to mutate, and because just having COVID once doesn't guarantee we're never going to get it again, and we have studies that show that our immune response to the vaccine in a lot of people is actually better than getting COVID the natural way. All those reasons are why folks should consider getting the vaccine, even if they've had COVID.
If I have a young, healthy family, why would I get my healthy 12 or 13-year-old vaccinated?
Yeah, so the question is, if I've got a young, healthy family, why would I think about having my child get immunized? It's a great question. I think it's one that every parent in the United States, around the world, has had to grapple with. It's not an easy question to deal with. And statistics only go so far, right? So I'm going to talk out of both sides of my mouth. Statistics only go so far, but here I go. I'm going to give you some statistics. Since the Delta variant has been the predominant circulating strain of the virus in the United States, the number of hospitalizations in kids 0 to 4 years of age has gone up tenfold. It doesn't appear that they're necessarily ending up in ICUs on a more frequent basis than they did before Delta, but they are getting hospitalized more frequently, 10 times more frequently. Then, if you look at the adolescents, those that are eligible to get the vaccine, if you're not vaccinated, you are 10 times more likely to end up in the hospital if you get COVID than if you are vaccinated. So the Delta variant is having a bigger impact, at least in number of hospitalizations in kids 0 to 4, and the vaccine is clearly mitigating your risk of getting so sick that you are going to end up in the hospital if you're a teenager. And the teenage population is one that now they are eligible to get vaccinated, so we have that comparison group. Obviously, those less than 12, we don't have the comparison group for yet, other than in the research trials, because they haven't been widely able to get the vaccine. Does that make, hopefully that makes some sense. Just tenfold increase. 0 to 4 years of age, tenfold increase that you could end up hospitalized if you get COVID. And if you're a teenager and you're vaccinated, you're 10 times less likely to end up in the hospital than if you aren't vaccinated. So the vaccine is very effective. I can tell you at Avera McKinnon right now, we are not seeing a big number of COVID positive pediatric patients. Those that we are seeing are coming from households where COVID is circulating. So if you want to protect your kids from getting COVID, from maybe getting COVID so severe that they end up in the hospital, make sure everyone that's eligible to get vaccinated gets vaccinated. It's one mitigation strategy, and it seems to be a very good mitigation strategy.
In the past history of epidemiology, is it typical for the adult population to acquire the disease prior, and then children get it a year later? This has kind of been an insidious virus in that it's age specific.
Yeah, so the question is about, from a historical perspective, have we seen this kind of thing where the adults get it first and then the kids get it later, a year later maybe? Not one that I can think of off the top of my head.
We've never seen this before in the history of the world.
Well, not one that I can think of off the top of my head. I can say that for sure. There's possibly an example out there. Yeah, it is interesting. Why, when we first started to see the virus, it affected the elderly population, and particularly elderly with some chronic medical problems. They were first, and it relatively spared our younger population. You know, when you think about chickenpox, polio, some of those traditional vaccine preventable illnesses, they seem to hit the pediatric population much more severely.
And do they hit them prior, before the elderly, or has there been any notice in that? I think I've already asked that question, but chickenpox or polio or measles, has that hit the children first before it's hit the elderly? Any knowledge of that?
So the question was, did things like chickenpox, polio, measles, I guess, right? We could add to that. Did that clearly hit the pediatric population before it hit the adult population? I think what we can say is it more dramatically hit the younger population. I'm not sure that it just didn't touch the adults at all. It just didn't seem to affect them to nearly the same degree that it did the kids. And the thought, I think, with a lot of those is that when the adults were kids, they were exposed to that in some fashion, developed some immunity, so then they were less likely to be as affected by it or affected severely by it when they were adults.
Dr. Elliott, what would you say to parents that are concerned that the vaccine was rushed and it's maybe not safe?
Great question. So there's some concern about the vaccines being rushed and how to respond to that. So it was interesting. There's been research on coronavirus, the type of virus that causes COVID, since the early 2000s on development of a vaccine for coronavirus vaccines. And the messenger RNA technique that they used to create the Pfizer and the Moderna vaccine, that was actually started in the late 80s, early 90s. So we just heard about messenger RNA vaccines last year as the general population, but they've been around for decades. They've been working on them. One of the challenges that they had with the messenger RNA vaccine was that it's not very stable. And so they would give it to somebody and it would just dissolve in the body before the body was able to make the proteins that are coded in the messenger RNA. They solved that by being able to wrap the messenger RNA in an envelope of sorts that protected it long enough so that the body could recognize it and create the proteins that it codes for, thus giving us protection. It was a culmination of that, figuring out that problem with the messenger RNA, and recognizing that we had a global pandemic and it turned out they could code for the proteins that could protect us against the SARS-CoV-2 virus. Those two things came together last year, and that's when it first came onto the public scene. But the technology, the messenger RNA technology, and the studies on developing a SARS-CoV, or at least a coronavirus vaccine, have been going on for several decades. So it isn't all that new. And the FDA, just to add to this, had mountains of data that they were able to review even before they gave it their emergency use authorization.
Do you see a timeline for the under 12 being able to get vaccinated?
So the question is, do I see a timeline for the under 12 getting vaccinated? I was told it was gonna maybe happen this summer, and that maybe we'd be able to vaccinate that age population before school started in the fall. That didn't happen, obviously. So I'm hesitant to very strongly make a lot of predictions on timeline. I do know that the FDA is looking at it very, very closely, that Pfizer specifically has submitted a request for folks under 12 years of age, but I'm hesitant to predict a timeline on that.
Question. If vaccinated people can carry COVID, how does it protect those that are not vaccinated?
So the question is, if vaccinated people can carry the virus, how does it protect the unvaccinated?
How does being vaccinated then protect the unvaccinated?
Okay, all right. So a little bit of this goes back to, and I apologize, folks. Again, I'm not an educator. I'm afraid I'd put a classroom of kids to sleep quickly. But a little bit of this goes back to biology. So I want to just start there with how does a vaccine work? It's not an invisible force field. If I'm standing or sitting next to someone that has the virus is replicating in their system, guess what? I get exposed. I'm vaccinated, but I still get exposed. It doesn't stop the virus from getting to you. What it does is it primes your body so it recognizes the virus quicker and can kill it before it has time to replicate millions of times, overwhelm your body with the virus, cause you to be sick. And when something like that happens, then you've got a lot of virus in your system. You shed a lot of virus, and you shed virus for a long time. So I'm standing next to someone that has the virus. I get it. But because my immune system's already primed, it doesn't have a chance to do much in me. My body fights it off quickly. So yes, I may be able to shed the virus, but not for very long. Maybe for a couple of days as compared to a couple of weeks. And I won't shed nearly as much of the virus either. So that's how, when I'm vaccinated, I can stand next to somebody who's not vaccinated. And if I have the virus, I'm going to shed a lot less of it, and I'm going to shed it for a lot shorter amount of time than if I didn't have the vaccine. I think that gets to that person's question. You want to know one of the best ways to improve the efficacy of the vaccine? Have everyone around you get vaccinated. That's the way vaccines work. I imagine many of you, if not all of you, have heard about herd immunity. What the heck is herd immunity? Well, it is just simply that. The more of us that already have a primed immune system that can fight this virus off, that can stop it before it has a chance to multiply millions of times in us, before we can shed the virus every time we talk, every time we cough, every time we sneeze, wipe our nose, then there's a cumulative benefit to it. If only one person gets, right, an extreme example, if only one person gets vaccinated, how well protected are any of us? Where if a majority of us get vaccinated, how well protected are the majority of us? While we're looking for other questions, I guess maybe I'll just broach a subject. Again, we're not defenseless here. You know, this virus has killed over 650,000 people in the United States. When this first came out, and some of the folks are saying, we might lose 125,000. If this gets really bad, we might lose 250,000 people here in the United States. And we thought they were crazy. Oh, here we go. You know, here are the folks, the doomsdayers out there trying to scare people. If they'd have said back in February or March of 2000 that we were going to lose 650,000 people to this virus, I can't even imagine. Cannot even imagine. So we have and will continue to talk a lot about vaccines. I really believe the data shows it's absolutely the best thing we can do individually and the best thing we can do as a community, as a country, to protect ourselves. But it's not the only thing. There are other options. Before we turned on the cameras, I was talking about how I grew up in North Dakota. Growing up in North Dakota, you learn about how to dress for the winter. And we dress in layers. And those of you in South Dakota know this too. Why do we dress in layers? Well, because you're not exactly sure what Mother Nature's going to throw at you. We have, similar to that, we have layers of protection that we can put on to protect ourselves against the virus. We can choose to wear a mask or not. We can choose to wash our hands. We can choose to socially distance. We can choose to stay home if we're ill. I think vaccines are the base layer. I think everybody should get one. That's my bias. I apologize for anybody that takes offense to that. That's my bias. But there's a lot of other things that can be done. What I can't tell you is what's absolutely the right thing for you to do as an individual. That's an individual choice, and you're going to have to make that one for yourselves. I can tell you that masks work to an extent. I can tell you that washing your hands using alcohol-based hand gel works to an extent. I can tell you that if kids are told to cough into their elbows or sneeze into their elbows, that works a little. Staying home if you're sick, guess what? That works. And I am as guilty of it as anyone. Pop a couple Tylenol and go to work, because I'm tough, because I grew up in the Midwest and that's the way my parents raised me. Maybe we have to rethink our philosophy on that a little bit. Maybe we've got to think about our coworkers and the other people we're around, and that we're not going to want to expose them to something, whether it's the common cold, influenza, strep throat, or COVID. Maybe we've got to just rethink some of that hard-working Midwest mentality. Just rethink it a little bit. So again, we're not defenseless. We've got layers of mitigation strategies, and I could not presume to tell you what to do individually. I just hope you give it some thought, listen to trusted sources, and make the best choice you can. Is there another question?
If I'm a healthy, active 16-year-old who's invincible, not worried that I'm going to be hospitalized, not worried that I'm going to die, what other benefits might there be to being vaccinated?
Okay. So the question is kind of if I've got that Superman mentality, right? Nothing can touch me. I'm young, I'm healthy, I'm invincible. What are the other benefits of me getting the vaccine? And that I think is where we weigh that individual rights and freedoms with what's our responsibility to our community. Maybe I'll get it and won't bother me a bit. But I know if I get it, I'm going to shed the virus. Maybe I bring it home and I've got someone in the house that's immunocompromised. And even if they got the vaccine, they didn't have a real great immune response to it, so they're susceptible to getting it. Maybe I have a grandmother or grandfather that's at risk. Maybe I have a sibling less than 12 who can't get the vaccine. They're all vulnerable. And how horrible would I feel if I thought I was the one that gave this virus to one of my loved ones, and if they had negative consequences as a result of it. I think that's a pretty compelling reason for all of us to give strong consideration to getting vaccinated.
Really, can you just, for a point of comparison, basically a rough percentage of South Dakota, of the entire South Dakota population that is vaccinated, currently vaccinated, estimated to be vaccinated?
Sure.
And what percentage of that teenager, 12 to 18 year old group is currently vaccinated?
Okay. So the question was about percentages of South Dakota folks that are vaccinated. I've been told that roughly 65, 67% of South Dakotans have received at least one vaccine. Maybe not fully immunized, but have received at least one. I think the national number right now is in the mid-70s. So we're not horrible. We got a little ways to go, but we're not horrible. As far as the 12 to 18 specific population and what percentage of them have been vaccinated, I'm afraid I can't answer that question. I would probably go to the South Dakota Department of Health website. I would imagine they could give detailed information. Or Lee, are you aware of a number? Okay, but that's where I would go, is the South Dakota Department of Health. I suspect they've got the percentages broken down by age.
You were talking about the total deaths throughout the country at being around 600,000. Is that accurate?
Yeah, the latest number I heard today, we climbed over 650,000.
Has the national morbidity rate changed at all?
It has. The question was, has the national morbidity rate changed? Yes, it has. I can't tell you what it is. I can't quote the number. I can tell you that life expectancy as a result of COVID has seen a decrease that we haven't seen since World War II. Our life expectancy has dropped about 7 years, which is significant. Any other questions?
I have a few other things. I like to do a little bit of research. I like to go out to the VAERS reporting system. You're familiar with VAERS?
I am, yes.
Okay. And that's the government reporting system that's sponsored by the CDC and the FDA, which is all about science. And as of August 27th of this year, I went out to the teenagers site to see what's happening with the vaccine, particularly the Pfizer vaccine.
Okay.
And I printed off the information for you so you would have it. You can go out and check the sources yourself. But teenagers between the ages of 12 to 19, this is a fairly new vaccine since May, correct?
Correct.
This group has had 7.5 times more deaths, 15 times more disabilities, 44 more times hospitalizations than all of the FDA-approved vaccines combined that teenagers are receiving. Are you aware of that?
I was not aware of that data.
I also did a search for all the cases of thrombosis, which is blood clots, for both the COVID shots and for all of the other vaccines. And cases of blood clots were 28 times higher among teens injected with COVID-19 than for teens injected with all other vaccines during the same time period. And this is according to the VAERS database. And according to the CDC, the recovery rate from COVID is between 97 to 99.775 recovery rate. Is that accurate?
That sounds right, correct.
Okay, from an analytical and a logical thought process, it would appear that the dangers of this vaccine outweigh the benefits.
Okay. So, you did that very well, and I'm not going to be able to summarize. But the statement is that it appears that the risks of the vaccine, certainly for the younger population, far outweigh the risks of getting COVID. Is that a fair summary?
Well, and I didn't give you numbers, but I did print some stuff off that's coming off the VAERS website. It's shocking. So far from this is August 27th, deaths from this vaccine alone are 30, disabilities 173, emergency room visits 3,575, hospitalized 1,603, life-threatening 316, blood clots 84. And,
Yep.
and then I have the chart of all the FDA-approved vaccines, which is like completely way down. So this vaccine is bringing those up exponentially.
Okay. So the
I wanna
concern.
be humble and I wanna
Yeah. No, it's, and you know what? Right. 100% appreciate that, and appreciate the fact that you're going to a source like the CDC to get your information. That is exactly, no, it is not easy, but that's what we should be doing. So I applaud you for that. We have to be a little bit careful about the denominator we use. We have to be a little bit careful about what does the VAERS website really tell us. Well, let me give you a simple anecdote to explain what I mean there. Let's say I get the vaccine today. Next week, unfortunately, I die in a car accident. My death certificate will get reported, and I will be classified as a death within 7 days or 21 days or whatever days from when I received the vaccine. Regardless of whether my death by that car accident was caused by the vaccine or not. That is one of the limits of the VAERS reporting system. It's good in that it catches all the data, but the interpretation of the data is challenging. You probably already knew that, so I didn't mean to talk down to you, but...
And I think it's highly reported because it is true that less than 20% of the doctors actually will report adverse reactions.
So the question was, is it true that less than 20% of the doctors will actually report adverse reactions? I have not seen, read, heard that data. I can tell you that physicians are not the only ones that report to VAERS. The vaccine website, actually, when I got vaccinated, asked me to report out, I think, the first day, the second, third day, and then weekly after that for months. So I didn't even need to report anything to my physician. I just simply filled out the screening that I got. If there are kids watching this, you're going to laugh at me. I scanned like a barcode kind of thing, and I got a little, reminder on my phone. I'm not technically savvy, but it was really easy to do. Quick, took me maybe a minute each time I filled it out. So even if there is hesitancy on the part of physicians to report, with this particular mechanism, physicians don't even have to report. It's all within the reporting of the individuals that got the vaccine. One other comment, if I may. One of the things that's been talked about is the risk of myocarditis, so inflammation of the heart muscle in young people following the vaccine. There was a report published by MMWR, part of the Center for Disease Control. This is preliminary data. I'm sharing it because it's the most recent data we have. It hasn't been verified yet. So trust but verify, right? So yep. So take this with a little bit of a grain of salt. They were talking about myocarditis and how frequently it occurred in young folks following the vaccine. 300 million doses of the vaccine between first dose and second dose in this population of people. 1,200 cases of myocarditis. So is that a risk? Yep. Is it significant if you get it? Yep. But the CDC, the American Council on Immunization Practices, the FDA, other agencies that reviewed this data said that they still believed that the safety of the vaccine far outweighed any risk from someone contracting COVID naturally.
One more thing I have.
Questions?
I have one more thing. You know, that National Childhood Vaccine Act of 1986, that Congress removed all liability from the vaccine manufacturers, and it places all the burden on parents should anybody experience a reaction or death. My question is, do you feel this experimental vaccine, would you stand by it enough to help a parent share the burden of liability should a child have a vaccine reaction or a death? Do you feel that confident about this vaccine?
Is it okay if I don't summarize that? Because I'm not exactly sure how you asked the question eloquently. With 100% certainty, I am recommending that we follow the FDA guidelines, those of the CDC and the American College of Immunization or Conference of Immunization Practices. Absolutely. I have to, because if I advise someone not to get the vaccine who should have, it is far, far more likely that they're going to have an adverse outcome than if I tell someone to get the vaccine. Bad things happen. There is no guarantee. There's no guarantee I get home tonight. People get in car accidents. There's no guarantee I wake up tomorrow morning. But I happily rolled up my sleeve and got this vaccine. I believe the science is clear. The numbers can't be argued. That you significantly reduce your risk of a bad outcome by getting the vaccine versus not getting it. And I will stand shoulder to shoulder with anyone that wants to. 100% believe that's what the data is showing us. But again, folks, you got to make your own decisions. I can't make those for you. All I can do is share the information, and I love having conversations like this because this is how we all learn. So very much appreciate each and every one of you and your questions. I hope I didn't put anybody to sleep. And don't stop the dialogue. Keep talking about it. Keep figuring out for each of you individually, for your families, for your community, what's the best way forward. Okay? Oh, yes. There you go.
All right. Well, I'm not going to talk long. I just wanted to thank Dr. Elliott from Avera McKinnon Health Services for this evening. As he said many times, this is a decision that is absolutely being left up to parents. And so instead of me giving my opinion to parents, we wanted to be able to have people call in and ask questions, those who are worried about it, those who are completely for it, because I just really want this to be something that as parents we figure out on our own, and that we listen to what the medical professionals say and then make the best choice we can. We had a year of experimenting with masks, so many parents kind of had a feel for what a mask was, did with their kiddo for 9 months, where the vaccine's a little bit newer. And again, this was a way for us to respond to those questions people had about the vaccine without interjecting just my personal opinion. So I just absolutely thank Dr. Elliott for, I've never met him in my life, but I sure do have an awful lot of respect for those on the front lines of this. And we just wanted to be able to maybe get some answers, because we know there's such an influx of information out there. Avera McKinnon Clinic, Avera Clinic, you guys got a lot of names, through a grant, they are able to have a vaccination clinic here at the school next Tuesday. So parents have already gotten that information. Should you choose, again, voluntarily on your own to participate or to have your child participate or our staff participate, there are those forms out online. If you were to miss the first dose next Tuesday and want to still get in on that second rotation, just give Dustin or one of the folks at the clinic a call. So any questions, you can always call one of us at school, but hopefully tonight was informative, and I thank everyone for the good questions, the good dialogue. And I just hope everybody stays healthy. Our numbers are staying great at Dell Rapids so far, so let's cross our fingers we stay that way. Thank you, Matt, Big Sioux Media, and everybody that tuned in. I very much appreciate it. Have a good evening.